Okay, now the last part of the topic, which talks about drugs and alcohol abuse. And as dear students, you are aware that it's a malaise, it's a big problem in the society, drug and alcohol abuse along with tobacco addiction. और कौन से एज ग्रुप आप जानते हो कि इसलिए ज़्यादा प्रोन है, उनको ज़्यादा ड्रग एंड अल्कोहल अब्यूज़ या टोबैको अब्यूज़ दे कैन फॉल प्रे इनटू इट? वो जो एज ग्रुप है दैट इज़ बिटवीन द 12 to 18 ईयर्स ऑफ एज, जिसको हम लोग बोलते हैं द पीरियड ऑफ अडोलसेंस. अडोलसेंस का जो पीरियड है दैट इज़ द मोस्ट रिस्की पीरियड वेयर अ पर्सन कैन फॉल इनटू ड्रग, tobacco and alcohol abuse. Adolescence means a period, it's a process as a child matures into an adult. तो वो जो बीच का जो पीरियड होता है बिटवीन 12 to 18 years is called as the adolescence period. It is a bridge between childhood and adulthood, and in this particular years you will see that there are many biological as well as behavioral changes that are seen in a person. You can see we experience the development of secondary sexual characters. So these are some of the biological changes. We see a changes in our behavior. Okay, एंड यहाँ पे हमारा काफ़ी सारा साइकोलॉजिकल डेवलपमेंट होता है. वी स्टार्ट अंडरस्टैंडिंग द वर्ल्ड, आवर पोजिशन इन द सोसाइटी, आवर सेक्शुअलिटी एंड आवर रिलेशनशिप विद आवर पेरेंट्स, आवर फ्रेंड्स. एंड so there is a lot of curiosity and excitement. There is a need of adventure that an adolescent feels. And ये जो है, ये काफ़ी बार ये जो curiosity है, it can motivate and motivate a youngster and adolescent to go for drugs and alcohol and smoking का abuse. ओके क्योंकि हमारे पास एक नेचुरल क्यूरियोसिटी होती है एज ए ह्यूमन बीइंग, और ये एज में एक्सपेरिमेंटेशन करने का काफ़ी ये रहता है, जज्बा रहता है. द पीपल आर मोर ओपन टू एक्सपेरिमेंटेशन, ओके, इन देयर डाइट and many other aspects of their behavior. Okay, now sometimes an, an adolescent does not know how to cope with exam stress, family stress. Okay, and कैसे प्रेशर हैंडल करने का, एकेडमिक्स का, और कभी कभी कूल बनने की एक इच्छा रहती है. ये सब में भी एक एडोलेसेंस जो होता है, इट कैन फॉल फॉर दिस ड्रग एडिक्शन. ओके, एंड ये जो एडिक्शन होता है, इट इज़ नथिंग बट डिपेंडेंस ऑन दीज ड्रग्स. ओके, because these drugs, they exploit the neurotransmitters and the receptors which are there in our central nervous system. Now, what are the different drugs? Let us see the different drugs. Okay, the first group of drugs is the opioids, which includes morphine, heroin, etc. Okay, and our brain has got receptors in our central nervous system and the gastrointestinal tract, and the opioid drugs, they exploit these. Okay, अब जो heroin है, it is commonly called as smack, and it is formed by the diacetylation of morphine. The natural form is morphine. Okay, and when it undergoes a diacetylation, then you get the artificial drug which is called as heroin, which is white, odorless and bitter in taste. It's a crystalline compound. Morphine जो होता है, it is obtained from the latex of poppy plant, which is called Papaver somniferum. Okay, it can be taken either by snorting or it can be injected. It's a depressant, it will slow down your body. Okay, and it is a sedative, and in medicine we use it as a painkiller and a sedative, especially for patients who are suffering from cancer or during surgery, or who are in palliative care. It is morphine is used as a sedative and a painkiller. The second group of drugs is cannabinoids, which are obtained from the flower tops, leaves, and the resins of a plant called cannabis plant. Okay, that is the cannabis sativa plant. और उसके अलग अलग पार्ट्स को यूज़ करके और अलग अलग फिर ड्रग्स बनते हैं, जिसका नाम मैरोवाना है, हशीश है, चरस है, गांजा है, जो उसकी गांजा उसके लीफ से बनता है. Okay, it gives you a feeling of elation, happiness. It affects the cardiovascular system. It is also abused by sports persons. Then we have got cocoa alkaloids, which are obtained from the plant Erythroxylum coca. ओके एंड ये डोपामीन का जो न्यूरो ट्रांसमीटर है उसके ट्रांसपोर्ट को इंटरफेयर करता है, जिसको हम लोगों ने क्लास में डिस्कस किया हुआ है, और जिसके वजह से अ पर्सन हैज़ अ फीलिंग ऑफ यूफोरिया और हैप्पीनेस. ओके एंड दैट टू बेवजह की खुशी, स्टिमुलेटेड रहेगा वो इंसान, एनर्जी बढ़ी हुई रहेगी. ओके एंड इट अफेक्ट्स योर सेंट्रल नर्वस सिस्टम. Then some other drugs are atropa belladonna and datura, which act as hallucinogens. When you start hallucinating, you start seeing sound and hearing colors. Understood? मतलब you start imagining things. That is called hallucinations. Okay. Then other group of drugs are barbiturates, amphetamines, benzodiazepines, okay, which can be used for treating depression and insomnia. The the another malice or another problem that we see in our society is the overconsumption of alcoholic beverages. और इतना कंजम्पशन हो जाता है कि द पर्सन का नॉर्मल जो बिहेवियर है उससे वो इंटरफेयर होता है. ओके एंड इट विल अफेक्ट हिज पर्सनल, फैमिली एज वेल एज सोशल लाइफ. अल्कोहल इज it reduces the activity of your central nervous system. So usually people take it to reduce their anxiety, tension, but they become addicted to it. And alcohol is very dangerous for the liver. It gets converted into acetaldehyde and it can cause liver cirrhosis, and untreated it can cause the fatty liver syndrome. Okay, first fatty liver syndrome which will lead to the cirrhosis ऑफ लिवर. सिरोसिस मतलब कंप्लीट लिवर क्या हो गया, आपका फेल हो गया. तो इनिशियल स्टेजेस को हम लोग फैटी लिवर कहते हैं. तो अल्कोहलिक फैटी लिवर से शुरुआत होगा, अनट्रीटेड रहेगा तो इट विल कॉज टोटल लिवर फेलियर. मतलब सारे लिवर के सेल्स जो होंगे वो फाइब्रस टिश्यू से रिप्लेस हो जाएंगे. अब हम बोलेंगे लिवर सिरोसिस हो चुका है. ओके एंड the another prevalent addiction in our society is addiction to tobacco smoke, okay, which contains the nicotine, and that causes the release of adrenaline acts on your SA node and increases your blood pressure. More blood to the brain means more alertness, जिसको वो लोग kick के नाम से जानते हैं. And the as we all aware, alcohol, the smoking causes multiple disorders, including cancer. It affects your lungs, and it affects the mental state of the person, etc. Okay. The withdrawal symptoms can include irritability, anxiety, craving, sleep problems, headache, and lethargy. Okay. So it's very important as a society that we know what are the prevention and controls for all these alcohol and drug abuse. Okay, and how to counsel the adolescents. Okay, so there are drug education and counseling programs. As a friend, as a teacher, as a child, as a parent, you should always look for danger signs. Okay, like skipping academics and drop in the academic performance, being more irritable at home, not making friends, becoming reclusive. Okay, these are some of the danger signs. Then as a adolescents, you should avoid undue peer pressure, and you should, if you feel you have such thoughts, you should always talk to your parents and your peers, and professional and medical help should be sought. And strict laws and penalties should be implemented on those people who are into the business of selling all these drugs. Then only as a society will be able to handle this problem of alcoholism and other type of drug abuse. So that is what you will go through quickly.